Here we have axial CT images through the level of the abdomen and pelvis on the left side after intravenous contrast, and we have a sagittal CT image through the lumbar spine on the right side in a 13-year-old male status post lap belt injury. In assessing the lumbar spine here, notice already here at the L3 vertebral body we have a horizontally oriented fracture extending from the posterior elements and extending into the vertebral body posteriorly with a posteriorly displaced fracture fragment along the posterior inferior corner of the L3 vertebral body. This is a chance fracture. This is a flexion distraction injury with distraction of the posterior elements here. This is a common fracture to see in a lap belt injury. Chance fractures have a high association with mesenteric or bowel injuries. If we take a look at the CT abdomen in this patient, notice already that many of the jejunal loops demonstrate wall thickening. These findings were consistent with bowel contusion. No free air or perforation was identified on this CT scan. However, the patient did have a delayed perforation that was not seen on this scan and was repaired intraoperatively. The other interesting part about this case is as we scroll more inferiorly to the level of the chance fracture, there is a subtle intimal flap here within the descending or the most inferior aspect of the abdominal aorta, consistent with a dissection. This dissection was felt to be a result of the chance fracture. There is also thrombosis of both common iliac arteries at this level as well. This was also proven with a subsequent CTA examination that demonstrated the dissection and the thrombosis of the common iliac arteries more clearly. So this was a complex case involving a chance fracture, which is a flexion distraction injury, small bowel contusion with wall thickening of many jejunal loops in the left hemiabdomen, as well as a dissection of the inferior most aspect of the abdominal aorta with thrombosis of bilateral common iliac arteries.